Good morning, and today I'm going to be showing you how to take our vital signs on my patient. And all the vital signs that we are going to take are pulse, the temperature, the blood pressure, and the respiration. They're all going to be recorded on the patient's chart. And some factors that can affect the vital signs is like illness, emotional factors, stress, fear, especially, if the patient's really scared of, dental offices, their heart's racing. Drinking or eating, example, like when we're taking the temperature, if they drink a really hot drink or they drink a really cold drink, their oral temperature obviously is not going to be normal. And so let's go ahead and take our patient's temperature. And so the normal oral temperature for a person is 97.6 to 99 degrees Fahrenheit. We can use either digital thermometers, tympanic thermometers, or let me go ahead and show you, or glass thermometers. We don't use glass thermometers no more because the mercury is, a health hazard, so we won't use that. So we are either going to be using the digital thermometer, which is pretty common. The tympanic one's common as well. So this is the digital thermometer. And this little thing pops out, and usually there's like a box that can be held in the back of it, and it has like these plastic tube things. So you take it out, you click on the plastic thing, and we're gonna insert it in our patient's mouth under their tongue. We're going to insert it, and we're gonna ask them to close their lips around it. And since it's digital, it tells you about in 10 seconds what their temperature is. We go ahead, take it out of their mouth, and then we just go ahead and throw away the plastic shield that was around it. And then for tympanic, it is this one. This one actually goes in the patient's ear. And that one, the same thing. It reads it in about 2 seconds, and and there you go. You have the patient's temperature. And now I'm going to move on to taking their pulse. So our normal resting pulse for adults is 60 to 100 beats per minute, and in children it's 70 to 120 beats per minute. But Tapatio here, he's an adult, so his should be around 6 to 100 beats per minute. And so there's two ways we can actually check their pulse. We can check it manually, where we make sure that their arm is either extended the same level or of their heart or a little below their heart. And their arm should, when they're out, should be well rested, either on an arm pad or a table, or just extended and well rested. And we're going to find their pulse by either getting the radial right here, the radial artery or the brachial artery. And we're going to palpate it with 2 fingers or 1 finger. Here, let me do it on this. With 2 fingers or 1 finger. And with that, we're going to count for 30 seconds. And then we're going to multiply by 2. Or you could just count for the whole minute. And so you count. And then that would be, whatever, beats per minute. And what I like to do as well during this time is I like to keep it here and actually do the respiration as well. But before I actually go to respiration, I'm actually going to go back and I'm going to show you a second way to read their pulse. Besides manually, we can actually do it with a pulse oximeter. And this gives a reading of the pulse, but mainly it's used for oxygen saturation, so how much oxygen is in our blood. It's this clip that goes onto the patient's tip of their finger. Let me show you what that looks like. It looks like this. And so it actually shows you, it's not used for reading a pulse, but it does give it to you. It does give it to us, and it's accurate. And so sometimes we can use that as well, just for something faster instead of sitting there and counting, And then actually moving on to respiration. This is how high and low the patient's chest goes while they're breathing. And so are they breathing really hard? Is it really deep? Is it really shallow? So we're going to watch the patient's chest rise and fall for a minute. And that's why I said while doing the pulse. And when you're done reading it and you have the number, you can just go ahead and stay there and actually do the respiration at the same time, because at that point the patient's already, calm. There probably won't be any really real changes to their respiration rate. And so it's a lot easier. A normal resting rate for adult is 10 to 20 breaths per minute. And then now moving on to the blood pressure, we're going to take the patient's blood pressure with this Figo nanometer. I might pronounce it wrong, but it's okay. It's this cuff with a little pump, and it goes around their arm. But first we're going to lay it out. We're going to flatten it out, make sure all the air is out of the cuff. We're going to wrap it right here in the patient's arm as tightly as possible, but as long as there's like one finger space like that can go under it, that's okay. And then once we have that finger space, we're actually gonna put the stethoscope, which looks like this, under that part. We're gonna grab the bulb, we're gonna lock it, and we're gonna start pumping it and squeezing the blood pressure cuff. And we're gonna slowly release the valve and listen through the stethoscope. And there's going to be a first distinct thump. That thump is our systolic pressure reading, which is the pressure of the left ventricle of the heart to push through oxygenated blood throughout our blood vessels. And then we're going to slowly continue to release air until the last sound, which is our diastolic pressure reading, which is when the heart is at a rest and it's allowing the heart to take in the blood to be oxygenated before the next contraction. So when the heart goes thump thump, the resting is diastolic blood pressure reading, and then the release is a systolic. And that is it for taking the vitals. Thank you.